Hello everyone, welcome to the World Bank Group, welcome to Washington, D.C., and welcome to the 2020 annual meetings. I'm Paul Blake, live for our global audience. For around 75 years now, many of the world's brightest minds have met annually to swap ideas, data, and research on the toughest development and economic issues facing the planet. This year, they meet yet again, albeit in an entirely virtual format. But while our corridors are quiet and this atrium is relatively empty compared to most years, you, the audience, have more opportunity than ever to participate. And here with me to discuss some of those opportunities is our social media superstar, Papsi Mariano. Papsi, thanks so much for being here.
Hi, good morning, Paul.
So I want to start, this is day 3 of the annual meetings. What's the conversation been like online so far?
You know, people are responding very well because we're having a wide range of voices this year, especially like we're hearing from community champions and leaders and youth. That's another thing that people are responding to, along with the voices of our global leaders.
And people are watching on Facebook, on LinkedIn, on Twitter. They can also watch on World Bank Live, which is where the live vlogs are happening and a poll is happening. Tell us a little bit about that.
So absolutely. So on World Bank Live, each event has a poll that you can go to. Please answer that. We appreciate the participation that we're getting. So far, it's a good result.
And we'll have the results of those polls here at the end of the program in about, I think, an hour and 15 minutes time.
Sorry, go ahead.
Go on. No, after
so
you.
These polls are actually across our social media channels as well.
Okay, good to know. Good to know. What's the engagement been like with the polls so far?
You know, we're very consistent with the numbers, over 6,000 votes so far. So I'm going to check in later with you on the results.
In terms of getting in on the conversation, there's the live blogs. People can post their questions there. We'll have an expert panel live here from the atrium in about an hour and 15 minutes time. On social media, what is the hashtag? How can people conversate there?
Yes, so for this event today, it's about protecting and investing on human capital. Please use the hashtag #InvestInPeople.
There's also a hashtag for the whole week, isn't there? Is that, if I'm correct on that?
Yeah, so the official hashtag for the meetings is Resilient Recovery.
Okay, invest in people for today. Resilient recovery for the whole thing. Very, very briefly, we've got about 15 seconds. There's the digital art project, the Mosaic. How do people contribute to that?
Please go to live.worldbank.org/mosaic and add your photo.
Okay, yeah, I added one last weekend, so. All right, Papsi, well, stick around. We'll look forward to having you back here in a bit. We're just moments away from today's big event, Human Capital in the Time of COVID-19. We have an expert lineup from all corners of the globe across all sectors, including Mari Pangestu, Managing Director for Development Policy and Partnerships here at the World Bank, Melinda Gates, co-chair of the Bill and Melinda Gates Foundation, Cyril Ramaphosa, President of South Africa and Chairperson of the African Union, Marai Chatterjee, Director of Social Security at the Self-Employed Women's Association of India, Abhijit Banerjee, economist and Nobel laureate, Dr. May Al-Khaila, Minister of Health for the West Bank and Gaza, Azucena Aberleche, Minister of Economy and Finance in Uruguay, Reha Dinemic, Deputy Minister of National Education in Turkey, Mohammed Akuji, Group CEO at Imperial, and Narinder Dev Mentena, Head of Global Strategy and CEO at Biological E Limited. Now, as I mentioned, we'll be back here live from the atrium in about an hour and 15 minutes, and I hope you'll join me for that. In the meantime, as Papsi said, get those questions in over at live.worldbank.org and respond to our poll. I'll have the International Finance Corporation's Stephanie von Friedeberg and the World Bank's Mamta Murthy here at about 1:15 p.m., that's about 17:15 GMT, to answer some of those. But now, without further ado, let me hand over to BBC correspondent Michelle Fleury, who's moderating today's event, Human Capital in the Age of COVID-19. Michelle, over to you.
Hello and a warm welcome to the latest event at the World Bank Group IMF annual meetings. I'm Michelle Fleury, BBC Business correspondent, and I'm delighted to be your host over the next hour or so. The issue we are focusing on today couldn't be more important. The World Bank Group estimates that 100 million people could be pushed into extreme poverty because of the COVID-19 pandemic. All the progress we've made in education, healthcare, social protection is at risk. The need for action is urgent. This year has been like no other, affecting all of our lives personally and professionally, but it's the poorest and most vulnerable who face the greatest impact. So how is COVID-19 changing the way governments are protecting and investing in people? How have response measures planted the seeds for a more inclusive recovery? And how can we reimagine the delivery of essential services in response to the pandemic while building a more resilient recovery? That's what we want to explore over the next hour. We're going to be hearing about the current response, the challenges ahead, and we're going to begin to build a vision for a future that puts protecting and investing in people at the center of national and global agendas. We have an incredible lineup of guests from around the world who can help us understand the challenges and the solutions. And before I introduce our guests, let me remind you of the many ways you can take part in this special event. We are, of course, streaming live in English, Spanish, French, and Arabic on World Bank Live, where experts are already taking your questions on the live chat. And of course, you can join the conversation at any time just using the hashtag #InvestInPeople. That hashtag again, #InvestInPeople. But first, here's a look at what's coming up over the next hour. Very impressive and a truly global lineup. And in the next hour, we'll be hearing from Turkey, Uruguay, India, South Africa, West Bank and Gaza, and Guinea. We'll hear from young people whose lives have been upended from this pandemic, and also from health workers on the front lines of the fight against COVID-19. First, though, let's take a look at the challenges we are facing in human development. As you saw there, just some of the challenges being faced in human development. Now, think about this. More than 1 billion children are out of school. Health services are limited in many countries. Women and children are especially affected, and very often there are no social safety nets. How does the international community respond to this enormous challenge? How do we protect a generation and create a resilient and inclusive recovery? To answer these important questions, I'm joined now by Mari Pangestu, the World Bank's Managing Director of Development Policy and Partnerships. And as many of you know, Mari was a cabinet minister in Indonesia before joining the World Bank and knows just how important investing in people is for increasing equity and economic growth. Mari, if I could start by asking you about the recently released 2020 Human Capital Index. What did it tell us about the outcomes we've seen from investments in people and the possible impacts of COVID-19?
Well, I think the good news coming out of the recently update of the Human Capital Index is that because we took a 10-year backward look. Between 2010 and 2020, more children than ever received healthcare and attended school. And this is important because those investments in people are key to unlocking a child's potential and improving economic growth around the world. But sadly, COVID-19 threatens to wipe out many of these impressive gains and leaving a potential lost generation as countries struggle to contain virus and save lives and rebuild their economies. The World Bank is estimating that about 71 to 100 million people will go into extreme poverty, measured at the international poverty line of $1.90 a day, and that 1.6 children are out of school, and there will be a permanent loss in education and learning with trillions of dollars lost in earnings for this generation of students. So I think our challenge ahead is how do we preserve the human capital gains that have been made and prevent a reversal?
So, I mean, how does the World Bank support countries as they're trying to deal with the impact of this pandemic?
Well, the World Bank has been, I would say, very fast in its response to the emergency health situation. We have deployed in just the last few months a program of to 100 countries to address the immediate health impact by providing the equipment, the essential medical supplies, and so on. But beyond the health crisis, we're also looking at how do we protect lives, livelihoods, as well as human capital. So social safety nets obviously play a very important role. And we have actually ramped up our investments in cash transfers by 10 billion and it will continue to roll over for the next 12 months. And it's affecting 1.1 billion people. It's reaching 1.1 billion of the most poorest and vulnerable. And on education, we are working with 65 countries, providing technical assistance and financial support. Because, you know, as schools have closed, you have to think about how do we deploy remote learning in countries where internet access is not something which is widely available. So you actually have to be very creative in your solutions. A no-tech solution using traditional methods, whether it's TV, radio, or even a simple handphone, to low-tech and high-tech to ensure that we can have remote learning be undertaken. And how do we also address the differential impact of the crisis on different vulnerable groups, women and girls being one particular group, because 70% of healthcare workers are women. Yeah. Women are the ones that are being affected most in terms of job losses in the informal sector and service industry. They have to stay home to take care of children and family. They're also more exposed to gender-based violence. And girls are more affected in terms of the schooling and later on when schools can reopen safely, going back to school. So these, you know, we have to make sure that we are addressing the vulnerable populations in the policy responses that we have.
I mean, one of the things that's been fascinating is the pandemic has exposed weaknesses and gaps in existing systems. I'm just curious, you know, how can a country's response today help address some of these enormous challenges that you've described?
That's a really good question. And that's really what I think we are humbled by this experience, let's say. You know, we use our past experience from crisis and our instincts about good policy and so on. But we are all, I think, learning and adapting. I think the key is how do we, as the situation is so fluid and things are happening very quickly, how do we adapt to the situation, self-correct, and then as we are doing that, find the opportunity to build back better. And I think today we are going to be talking more about that. But let me just highlight some of the things that are coming out just as we are rolling out our programs. On social protection, these programs used to be very targeted to the extreme poor. But in this crisis, the impact is broad. So we've had to broaden the target, make it broader and scale it up. And how do you identify beneficiaries? This is part of the adaptation that was needed, the data that needs to be there. And then hopefully that data can be used to build back better systems. And then adapting it also to that. It's not just cash. Some people need food. Some people need jobs. Some people need livelihoods. And the youth need unemployment benefits. On education, remote learning, I mentioned how it's not just about the internet and online learning. How do we go back to the television and the transistor radio also to help remote learning and help learning at home? Because not everybody can go back to school. And even when you go back to school, how do you catch up the learning losses? There has to be learning at home. And then mobile banking for cash transfers. That's another innovation and creativity that's happening as we are working on the ground. And as you are delivering health services for the pandemic, how do you make sure you don't forget about the other important health services like maternal health or children vaccination? And then as you're doing this, you have to continue to improve and strengthen the health systems. So this is kind of the learning on the ground. And we are really, I think it's all about adapting, adjusting, and building back better, building systems, data, and better delivery and monitoring of the services that we need to deliver.
That's a good place to end on a positive note, an opportunity there to build back better. Yes. A big thank you to Mari Pangestu, the World Bank Group's Managing Director of Development Policy and Partnerships.
Thank you, Michelle.
I'm Luis Osorio Flores in Washington, D.C., and you're watching the World Bank IMF annual meetings.
A big thank you to Mari Pangestu from the World Bank. And just to remind everybody that you can post your questions in the live chat. We'll be answering as many as your questions as possible in a special live event which takes place immediately after this in the World Bank Group's atrium in Washington, DC. And of course, you can always share your thoughts, your comments, just use the hashtag #InvestInPeople. Frontline workers around the world have become the heroes of this pandemic, risking their lives to protect ours. Let's take a moment to hear the challenges they face.
The biggest challenge for me as a caregiver for patients with COVID-19 was not seeing my family for a very long period of time.
My unit has only COVID-19 patients. The biggest challenge is when I'm intubating a patient that needs ventilation support to keep breathing. I need to be really fast and really precise dealing with COVID patients, since when it comes to this, they are facing imminent risk of death.
COVID-19 has brought a lot of issues in this community, Kibera. You can see the young girls became pregnant because they couldn't afford online learning. In their houses, there's a lot of gender-based violence because the parents were sacked out of their jobs.
Nos offres, c'est essentiellement la planification familiale et la santé de la mère et de la reproduction. Mais depuis l'avènement du COVID-19 au Sénégal, on a eu pas mal d'obstacles pour continuer nos consultations.
The biggest challenge for me this COVID-19 in my work has been the fact that our clients can't come through physically to our offices to access our mental health services.
The biggest challenge is to keep the medical staff safe, strong, and motivated. I'm trying very hard to keep them safe from burnout syndrome.
Several of my colleagues gotten sick, so we are trying to save patients, but we also need to protect ourselves.
I'm responding to this challenge by taking the extreme precaution to the virus to avoid infecting ourselves and others.
On the good side, COVID-19 has become a catalyst for the adoption of telemedicine. So we launched the first tele-guided do-it-yourself swab test, and that reduces the spread of infection, improves the turnaround time of results, and reduces stigmatization.
We have taken advantage of digital platforms and virtualized all our sessions and are now conducting our sessions online.
We are racing to save lives while also ensuring the vaccine is safe and effective. There is an enormous amount of data for me to observe every day, and I am working longer hours to ensure that we get this right at this moment.
We just want to do our best and the feeling that we are doing something that matters. We just want to make them feel safe and we provide them the care that they need.
So humbling to hear those stories, and a good reminder of why the subject of this session, protecting and investing in people, is so important. Okay, so this is the point at which we want to hear from you, the audience. We're going to be running a live poll throughout this event, and we are asking this question: which of these will be most important for a resilient, inclusive recovery from COVID-19? Is it A, delivering vaccines to the most vulnerable, B, safely reopening schools, C, providing cash to struggling families, or D, ensuring girls and women have equal access to jobs? Once again, the question is, which of these will be most important for a resilient, inclusive recovery from COVID-19? Is it A, delivering vaccines to the most vulnerable, B, safely reopening schools, C, providing cash to struggling families, or D, ensuring girls and women have equal access to jobs? Now, you can cast your vote on World Bank Live, and the final results will be revealed during the live show that follows right after this event, so do stay tuned. We'll also be putting your questions directly to the bank's top experts in that show.
I'm Jasmina Hadjic in Sarajevo, Bosnia and Herzegovina, and you're watching the World Bank Group IMF annual meetings.
If you've joined us just now, a big welcome. This event on protecting and investing in people is the third public event of the World Bank Group. But don't worry, if you've missed anything, you can watch all the previous events and check what's coming up on World Bank Live. Now, our next guest has made gender equity a focus of her work over the past decade and knows that empowering women and girls can bring transformational improvements in the health and prosperities of not just families, but also communities and societies. Her work has led her to focus increasingly on gender equity as a path to meaningful change. Melinda Gates is the co-chair of the Bill and Melinda Gates Foundation, and when I spoke to her earlier, I asked her how women and men were being affected differently by the pandemic.
Well, we're seeing it show up in incredible ways. I mean, while we know that more men are dying from COVID, when you look at the statistics, it is affecting women deeply, because what happens, and we know this from good data from the Ebola pandemic, is you have these shadow pandemics. You have a shadow pandemic of domestic violence. You have maternal mortality. We're already seeing it on the rise. Just like in the Ebola crisis, we lost 5,000 more women's lives than we would have otherwise because they didn't want to go in the health system because of Ebola being there. The forecast is that we'll lose an additional 115,000 women's lives from the shadow pandemic of maternal mortality and the health system not feeling safe for women. And as well, on the economic front, women are losing their jobs at twice the rate that men are. We know that they're not having as much access to the capital markets right now. And as well, we know that while they're losing their jobs, the burden of unpaid labor is going up because women are 2.5 times more likely to do the unpaid labor in their house. Now there's the labor of the children at home and caring for the elderly. So it is a huge disproportionate effect on women.
So it sounds like it's the social environment as well as the health issue that's really behind this.
Absolutely. And I think one thing people don't sometimes realize also is when we think of who are our healthcare workers in countries, 70% of those are women. So they are really at the front and center of this crisis.
You said you see an opportunity for huge change. What is the risk of not doing anything, of not addressing this?
If we don't put women at the front and center of this agenda, we are going to have a very, very slow recovery. You know, we have to get global trade fully up and running again. And so it means we have to think about everybody else. We have to think about people in low income countries because COVID anywhere is COVID everywhere. And so if we only focused on high income countries or high and middle income countries, you're not going to have the supply chains we need to keep everything going. And so I think it's a risk that if we only think of ourselves and our community or our country or our state, we're not going to get this recovery up and running, get the flywheel up and running as quickly. And so we have to think about things like the World Bank thinks about what they call human capital, which is really people's health, their education, their economic opportunity, and their voice. And we're seeing citizens speak up because remember, all of a sudden COVID is exposing these cracks in societies that we've had, these inequities. And so you're seeing the road to recovery is going to be very slow if we don't get those 4 things up and running well.
Melinda Gates, thank you so much for your time and lots to think about there.
Thank you, Michelle. Glad we could speak.
Melinda Gates there speaking to me earlier. A quick mention of another opportunity to engage. As you know, a resilient recovery is the theme of these meetings, and we're asking you to send us photos of what resilience means to you. We're adding these pictures to a virtual mosaic, and you can see how that's shaping up and upload your own pictures on our website. Now, we know that young people have been especially affected by the COVID-19 pandemic. They miss out on school or university, face unemployment, have to support family members, and encounter gender violence or depression. Let's hear from young people around the world about their experiences, their fears, and also their hopes.
COVID-19 को संख्या हाम्रो देश नेपालमा दिन प्रतिदिन बढ्दै गएको छ। परिवारको सदस्यलाई नभेटेको महिनौ भएको छ। साथै बाह्य दैनिक क्रियाकलापहरुमा पनि ठप्प आएको छ।
I'm graduating in a few months and now the labor pool has become much more competitive than ever before. The travel ban and the travel restriction do not allow me to explore my job opportunity abroad or advance my career in the way that I want to.
I'm a teacher in a private senior high school here in Ghana, and due to the pandemic, schools have been closed down for some months now. But unfortunately, unlike the government sector, most private schools have been unable to pay their staff since then.
Apart from putting the health sector at risk and stress, this pandemic has brought other ramifications in other spheres of lives as well. The incidences of domestic violence in my country are on a rise.
You know, we've seen gender-based violence going up, we've seen depression cases going up, and we just need the government to support us in terms of access to psychosocial support, access to cash transfers, access to food distributions.
A resilient recovery will only come if countries invest heavily in the health sector. And this also is the area where youth can play a key role through innovation.
I believe in 2 things, unity and strategy.
We Peruvians are strong, resilient, and enthusiastic people.
We will overcome this. Just make we continue, look out for each other, and help each other.
It's amazing to see all those young people who live around the world, and yet the challenges they face are similar.
I'm Hải Yến in Hanoi, Vietnam, and you're watching the World Bank Group IMF annual meetings.
Well, let's move now to Africa, where COVID-19 continues to take hold across the continent, and the situation is evolving quickly. The pandemic is taking a toll on lives and economies, pushing the region into its first recession in 25 years. President Ramaphosa of South Africa, also currently chairperson of the African Union, sent us this message for a more inclusive and resilient recovery.
Leaders of the World Bank Group, Excellencies, ladies and gentlemen, the coronavirus pandemic is having a deep and profound impact on the world. It has devastated livelihoods and economies and set back our ability to meet the aspirations of the 2030 Agenda for Sustainable Development. For countries with low levels of development, the situation is particularly dire. As the African continent, our response to the pandemic has been both strategic and collaborative. Our strategy in dealing with COVID-19 has been based on 4 pillars. The first has been in developing a continental response to the virus. This has been led by the Africa Centers for Disease Control and Prevention, which in collaboration with the WHO has advised African countries on various disease control measures and protocols. The second has been in raising resources through the African Union's COVID-19 Response Fund. The third pillar has been in setting up a continental platform for the acquisition and distribution of diagnostic and therapeutic supplies to countries in need through the Africa Medical Supplies Platform. The fourth pillar has been the appointment of special envoys to engage with the international community to mobilize the financial support that African countries need. Firstly, to ensure an effective public health response to the pandemic, and secondly, to enable their economies to recover. As a country, South Africa's response has sought to save lives and protect livelihoods. While we acted swiftly to implement a nationwide lockdown which delayed the surge in infections, we also put in place significant economic and social relief measures to protect businesses, workers, and households. We introduced measures to support the poorest households and small businesses. Nevertheless, the financial fallout of the pandemic will be severe, not just for South Africa, but the entire continent. Countries will struggle to meet their obligations to their people, with critical resources having been diverted to fighting the pandemic. We are continuing to call for a comprehensive economic stimulus to assist African countries to mitigate the effects of the pandemic. We're encouraged by moves by the international financial institutions to provide relief to indebted countries and reiterate our call for a moratorium on interest and debt repayments by stricken countries. This will afford African countries the fiscal space we sorely need to rebuild our societies and our economies. For every African man, woman, and child to realize their full potential, we have to continue to invest in poverty eradication, in education, and in improving health outcomes. The pandemic has once again brought to the fore the importance and necessity of universal healthcare coverage. We have to turn this period of crisis into one of opportunity to build resilient economies on the African continent. We have to support the development of small businesses across the entire continent. We have to take advantage of the dramatic changes the pandemic has brought to the world of work by equipping our people with the necessary tools and skills to take up occupations in a technology-driven economy. We want to attract higher levels of investment in our natural resources sector, in renewable energies, and in agriculture. It is our intention to increase and not decrease social spending to narrow the deep inequalities that exist in our respective countries. It is only through solidarity that we will be best able to seize the opportunity presented by this pandemic to bring greater economic security to the people of Africa, to revitalize the continent's economies, and to deliver equal opportunity for all, so that no one is left behind.
We're going to focus now on the experience of individual countries to hear how they have responded to the pandemic. Have previous investments in health, education, and social services helped with their current response to COVID-19? And how are they building a more inclusive and resilient recovery? Let's begin with someone who has been working at the grassroots with the poorest and most vulnerable people in India, and who knows the importance of health coverage and social protection. Mirai Chatterjee is the Director of Social Security at the Self-Employed Women's Association in India, also known as SEWA. When I spoke to her earlier, I started by asking her how governments can best protect the most vulnerable, especially women and children.
Well, first of all, governments like mine, India, need to invest much more in public health, particularly primary health care. Unfortunately, we have underinvested for years, and therefore, during the COVID crisis, we've had a pretty tough time, I must say. Second, I think we need to invest in frontline health workers, particularly women. Women frontline health workers through the pandemic in India have shown yet again that they are second to none. They're ready to take risk. They're inclusive. They are local. They know what people need. They make sure no one is left behind, particularly the most vulnerable like women and children. So invest in frontline health workers, particularly women, and of course, other health workers. We need many more nurses. We need doctors, particularly in the far-flung states of our country, like the Northeast, or like Central India and Eastern India, which are traditionally underserved. And the third is infrastructure. And by that, I don't mean just buildings. Of course, in some places we'll need buildings, but we need equipment, we need supplies, we need medicines, particularly as per WHO's essential drug list. So those are some of the things that I think we need immediately. We need to invest now and not wait for the next pandemic. Well, the informal women workers who I work with in India, I think first and foremost, the hurdle is to even understand the public health system, to have the information about what their services are, what are their entitlements, where to go, whom to approach, how to approach. These things are not known and are not immediately obvious to women at the grassroots level. And that's where the power of collectives comes in. Because individually, it's very hard for her to access these services and entitlements. But when she is in her collective with her sisters, like cooperatives, unions, self-help groups, local groups, then she finds the strength to not only get the information, but to navigate the system and actually get access to those services and entitlements. And furthermore, once she is in a collective, it's also easier for the public health system, for the local health authorities to link up with her and her collective. So it's a win-win situation. It's a partnership that develops to make sure that these services and entitlements actually reach the last mile.
And we're going to pick up on some of Mirai Chatterjee's thoughts there with our next panel in just a minute. But quickly, a reminder that there are more events to come in these World Bank Group annual meetings, and you can find the full schedule on the World Bank Live pages. Also, join the conversation using the hashtag #ResilientRecovery. Now, let's take some of those ideas on how to protect and invest in people and discuss them with our next 4 guests. Abhijit Banerjee is one of the winners of last year's Nobel Prize for Economics. We are also joined by senior government leaders from 3 countries. Azucena Arbeleche is Minister of Economy and Finance for Uruguay. Riha Denemac is the Deputy Minister of Education for Turkey, and Dr. Maya Al-Khaila is the Minister of Health for West Bank and Gaza. Thank you very much all for joining us today. Professor Banerjee, if I could start with you. Your work has focused on the best ways to alleviate global poverty. What investments should countries make for greater equity and economic growth? If you could give it to us in 3 top recommendations.
Yeah, I'm going to, that's $1 million question, and that's sort of half of my life's work. You want it in 3 minutes. I'll kind of pick up the things that I think this COVID episode has highlighted as a way to just cut through the million options. I think one of the things is in terms of education, what is highlighted is how much of the potential for online education is unexploited. I think that's probably the thing that we've seen little pieces of research. We did research 20 years ago, in fact, showing that computers can be very useful, but I think that research has sort of been slower than I would have thought. So I think it's what we see very much is that there is an enormous capacity for scale there. That there are great courses, and the great courses are available, often free, but somehow the link between those courses and the children in rural Malawi are not happening, and that's a tragedy, because in some ways they are A, deprived from school, B, these courses that are available are not getting to them. And I think this course is so great that we should think of ways of making them available even when school can reopen. I think that's one of the issues this is absolutely clearly highlighted. In health, I would say what I see as being one of the issues that I just had no sense of how important it could turn out to be is this. With COVID, really, the treatment has evolved. The new protocols are better, but this happened pretty quickly. What hasn't yet been figured out is the public service messaging, the health messaging. I think one thing that's really critical in this is just doing a few things make a very big difference. And I think that there's lots of experimental evidence, the kind of experimental work we do, suggesting that, for example, when you remind people that the US government is led by President Trump, who often says one thing and then changes his mind or says something different, they stop trusting what the Center for Disease Control says to them. They start ignoring messages. And more generally, there's probably too many messages. In West Bengal, where we collected data, people were getting 2 messages a day, but they weren't following them. And we have to find ways to get the message through to be more concrete. Finally, on social protection, I think this is completely clear that we need mechanisms of social protection that don't depend on dealing with people where they are, but where they're from, but where they are. We need to deal with people where they are. Migrants need to be able to access it, and more generally, the social protection system needs to be flexible to say that in this area we have a particularly big disaster, let's send some money there. So I think that just that building in an infrastructure that's both flexible and tied to an individual, and at the same time sort of creating a financial base for it so that you have money that you can then allocate to people, rather than saying, well, now we don't have money because we have a disaster going on. I think all of that needs to be thought through in this context.
Mr. Banji, lots to sort of take in there. We're going to talk about the education portion of that coming up a bit later, but I want to talk to Ms. Minister Arbeleche and to hear about Uruguay, whether you have followed some of these recommendations around health, around social protections, because Uruguay does seem to have handled the pandemic well.
Thank you. First of all, I would like to thank the World Bank for this invitation and for the chance to present to this distinguished panel the case of Uruguay, a small but brave country in South America that, yes, has been performing well in this global fight against the COVID-19 pandemic so far, of course. Still, we have enormous challenges ahead. So Uruguay is a country with a population of almost 3.5 million inhabitants. The first case of coronavirus occurred in mid-March. So far, at the end of September, there have been around 2,000 confirmations of persons with the virus and 47 deaths. Nowadays, there are only 2 patients in ICU, with 200 persons still recovering outside hospitals, mainly in their homes. These numbers result from a current rate of testing of more than 600 per 1 million inhabitants. But more importantly, 6 positives every 1,000 tests. Of course, it's always possible to improve the detection of new cases. The analysis of the whole group of indications so far allows us to declare that the pandemic is under control right now in Uruguay. So how did we handle this? First of all, we assured that all the resources needed to attend the health emergency would be available, and we delivered. We also implemented a large number of social assistance measures that played an important role in serving the most vulnerable population. Finally, we ensure the necessary measures to deal with liquidity problems that companies will go through in the face of a shock. This shock we knew would be temporary but intense, so that the liquidity problem didn't change into a solvency problem. Since the beginning of the pandemic, the government was very clear to decide not to enforce a countrywide lockdown or a mandatory house confinement. Rather, it trusted citizens to adhere to voluntary social distancing and following hygiene protocols. We appealed to what we called individual freedom with social responsibility. In parallel, the government took early and decisive action and sealed off land borders, closed air traffic except to chartered repatriation flights, suspended all public events and in-person school classes, limited visits to nursing homes, and encouraged citizens to stay home and telework. There has been an effective coordinated response between public and private sector and the scientific community, strengthening the healthcare system and facilities, and carrying out an extensive randomized testing and community tracing in outbreak areas, such as the border with Brazil, which has been quite a trouble for us, and nursing homes. The government developed a roadmap for reopening of the different activities in consultation always with scientific experts and private sector representatives. In summary, I would say Uruguay has established successful management of the crisis, combining freedom with responsibility, scientific knowledge with political leadership, and a powerful combination of health, social, and economic measures based on our traditional strengths.
So it sounds like policy guided by science and a clear messaging of that. But obviously the options open to Uruguay, not necessarily available in other parts of the world. Dr. Al-Kailo, if I could bring you in here. You are the health minister from Gaza and West Bank, and you probably, I would imagine, see a very different reality given the fragile context. That being said, West Bank and Gaza actually have shown significant progress in providing health and social services over the past years. Can you tell us what particular challenges West Bank and Gaza are facing during COVID-19? How are you addressing them?
Good afternoon, everybody. I am honored to be with you, this high level of professionals from the whole globe. And I'm really appreciating that you involve Palestine in such an important session. Indeedly, in Palestine, we have different atmosphere and different... indeed, in Palestine, we have, of course, we are different than any other country and from Uruguay, especially that you know that we have a political and financial crisis these days, and appreciating that the World Bank Group have invited us and looking for the COVID pandemic. I can say that in March, we started the first cases in Palestine. However, we have until now in West Bank, Gaza, and East Jerusalem, around 50,000 cases, which was diagnosed. We have the rate of recovery is 81%. And the rate of hospitality is around 5%. ICU cases only 1%. Those who are using ventilators, I mean. But we have lots of challenges. Out of these challenges, the first of all, it was a challenge. How can we prevent the spread of the coronavirus in the Palestinian community? And for such we have responded rapidly, and starting from the presidency, where they also, as in Uruguay, there was a very early decision to close the country, whether it's education or public events, or schools, and it was running this for 1.5 months, which helped us a lot to prevent the spread of the virus. However, we have a challenge of the surveillance system because it was a real challenge to go ahead with our policies. Therefore, the remedies that was taken is to have different levels of committees that can control all the policies that was taken by the government cabinet. And in this case, we have done what's called COVID emergency hire committee, which involved the 6 ministries: Ministry of Health, Ministry of Economy, Ministry of Foreign Affairs, Ministry of Internal Affairs, Ministry of Agriculture, and the Ministry of Local Affairs, and Ministry of Labor. And also representative of the governorate and representative of the private sector, and it was all headed by the Prime Minister. And out of this, there was different committees at the level of the community, at the governorate and communities. And this helped us a lot because at least we could have our information from the ground, where we could have taken our decision when to lock, when to open areas, what we should do on the economic and in the economic status of Palestine, especially that we are passing through an economical crisis.
So that coordination was key.
Yes, it was a key issue, the coordination. Right. Not only among the government, but among the government, private sector, and civil society. And there was a real, very good coordination and very good cooperation. And this helped us to decrease, according to WHO study that was done last August.
Sorry to interrupt you, Minister. I just wanted to move on and pick up on that point you talked about coordination. One thing we haven't touched on yet, but everyone has mentioned, is education, and that seems to be so key, schooling. I want to turn to the experience of Turkey. Minister Denemat, you are the Deputy Minister of Education in Turkey. You have provided distance learning to more than 18 million students, involving 1 million teachers during school closing. How did you do this? What were the lessons you learned?
Thank you, Michelle. I would like to extend my regards to all of you. First of all, believing the importance of the sharing measures, I would like to thank you for organizing this crucial meeting, for inviting us and providing the opportunity to exchange our experience, and also internationally, and also enable us to learn mutually. Let me say something about what we did. Is in many other countries, face-to-face learning was discontinued last March in Turkey. We were able to give a quick response to compensate for the negative educational effects of the pandemic. We were able to do, since ministry already had an online platform. Only 1 week after the closure of schools, we started distance education on our national TV channel. The ministry also provided online education for primary and secondary students, secondary education students, and Education Information Network, which we call EBA, our online learning platform. The lessons learned in this process could be summarized as it is critical to reaching all students, and thus all necessary measures must be taken in this respect. Our ministry established 1,420 EBA support points to reach the students who cannot participate in remote education from their home. Furthermore, the GSM operators in Turkey are providing access EBA content free of charge for their users in order to avoid any internet quota problem. It is very important. The other important issue is to take the necessary measures for students with the special education needs. This remote education program has considered the needs of hearing impaired, visually impaired, and psychologically and mentally challenged students. They are also, in this program. When an online platform is created, training must be designed for the use of all stakeholders, including the teachers, students, and parents. Parents also very important for distance education, especially in this age era. Our minister provided supports and maintaining for teachers and all different branches for both public and private schools. These are the things, I would like to say about, what we did for our 18 million students and 1 million teachers in our huge education system.
Dr. Banerjee, Mr. Banerjee, I saw you nodding there when Deputy Minister Denimach was speaking.
Yeah, I mean, I actually all of the ministers, in a sense, echoed, I think, a similar point, which is that you have to think in scale and think through coordination, and that's always, I think the challenge in any of these things is, you don't really usually start from a situation where you have the mechanisms available. So how do you pivot a big ship on a dime very quickly? And that's a challenge, and that's why coordination is a word that keeps coming back. But also, I think this idea of actually having expertise. I think that's what many countries just don't have the expertise on the ground to do the kinds of things you described. They've been flailing. And in many ways, I think that one thing this brings out, I would say this episode brings out, is the need for us to share these learnings. What did you do? Why did it work? I think this conversation that we're having is crucial in the sense that it's the central piece of what we'll take away from this episode is, how do we do things better? And I think that the learning from all the ministers' speeches were very useful for me.
There's a lot to get through and not enough time, as always. But Minister Arbalete, a quick question. You are the only finance minister here with us today. How do you convince, we heard from Dr. Alkaila, they're talking about departments working together. How do you convince or make the case to get budgets approved at a time when they are effectively constrained in part because of the pandemic?
I think that this question has been answered by my colleagues, by the different ministers. As we said, the coordination amongst the different ministers, health minister, labor, social development, education, in Uruguay, as in the countries in West Bank and Gaza, in Turkey, that we have just heard, have been crucial. The coordination between the private sector and the public sector also, and the coordination with the scientific community has been, in the case of Uruguay, has been, I think, key to the way the pandemic has been managed. And yes, we did present during the pandemic our budget law for the next year with a different focus, not looking at improving the fiscal accounts. That was what we wanted to do when we first came in office in March of this year. But 10 days after that, we heard about the COVID cases in Uruguay. So the focus changed completely, and we allocated all the resources into facing this pandemic.
So are you saying that that people around you understand the importance of investing in people at the moment?
Absolutely, yes. And I think it has been the crisis, the pandemic has helped us to present the budget law for the next 5 years with a different focus, so that what it's important is the person and not what the money we spent or how nice our policies are. It's the results that matter, and it's the patient, the student, people having a better house that matters, and not the money we spend and what we do. It's what we achieve and the impact we have in our people. I think that in that way, the crisis has helped to shift into this new way of looking at the budget.
Very briefly, to Deputy Minister Demenach, what is the key thing when you look at investing in people?
Well, our aim in all these areas in investment, make sure students at the K-12, including those with special education needs, have access to a quality and inclusive education. Some of the concrete steps we planned could be one is, this academic year, and we would like to plan to shut 1,719 in total. And also the largest distance education vocational development program in the history of Turkey education has been initiated. We did that things, and hybrid education system will be carried out. The theoretical part of the vocational courses will take place through online education, while practical courses will be at school. This is the new thing we are going to do in the future, and we are going to do right now.
And Dr. Al-Khaila, a similar question to you. I mean, you have created a social safety net. How do you continue to do that going forward?
Actually, we need to continue having a social solidarity among the Palestinians, and therefore social security, and in between brackets, because this is one of the major issues that can help us, especially in a status where Palestine is living an economical crisis due to the revenues that Israel is confiscating, as everybody knows. Therefore, very little money we have been generating from the Palestinian society because of the closures and the economical lockdown of in the last few months, and it's slowing down also in these months. Therefore, there was. We have mobilized women groups and the local governance as municipalities, women groups, and also volunteers to work with us on different issues. First of all, on health education, on giving social support, whether it is in kind donation or it is on other levels. As well, we mobilize the Palestinians in the diaspora, and they send for us real donations that could help us, especially to support those families who are in the quarantines.
Sorry to cut you off there, Dr. Al-Khaila. We are running out of time, but I want to thank you very much, and also for bringing up the question of gender. This has been a very rich discussion, clearly a lot more to be discussed. We've had a glimpse at what different countries are doing to protect and invest in people, from the long-term investments that pay off when a crisis hits to the policies that accelerate during a crisis. So I want to say a big thank you to all my guests for being here, and I wish we had more time because clearly lots more to say on this.
I'm Tom Perry in Sydney, Australia, and you're watching the World Bank Group IMF annual meetings.
I'm Michelle Fleury, and if you have just joined us, don't worry, there is still plenty to come. And there are also lots of ways to join this conversation. We'll be answering your questions live straight after this event, where we will also reveal the results of our poll. Now, a reminder, in case you missed it, we are asking which of these will be most important for a resilient, inclusive recovery from COVID-19? Is it A, delivering vaccines to the most vulnerable, B, safely reopening schools, C, providing cash to struggling families, or D, ensuring girls and women have equal access to jobs? And you can cast your vote on the World Bank live page. So go there now, cast that vote. Now, fair and equitable access to a reliable vaccine for everyone everywhere will be an important step along any road to recovery from this pandemic. Fortunately, prospects for vaccine development are bright, with significant resources invested in research and development. But what about the manufacturing and distribution of a vaccine once available? That's something that my next two guests are very much involved in. Mohamed Akuji is the CEO of Imperial Logistics in South Africa, a Pan-African company, and Narendra Dev Mantena is the CEO of Biological E in India. Mr. Mantena, if I could start with you. Biological E is a family business that manufactures vaccine. Now, we know there is going to be huge demand for a vaccine against COVID-19, billions of doses required to ensure everyone can get vaccinated. What are local pharma companies like yours doing to prepare for the mass production once a vaccine is developed? What is needed to help companies do this?
No, thank you, Michelle. I think we need to distinguish between pharma companies and vaccine companies. I think while pharma companies may have the capability, they cannot just turn on vaccine manufacturing on a dime. So it is likely that the vaccine manufacturers are going to make the difference initially. So it gives some time for the pharma companies to be able to ramp up and learn the skills. So as a company, and we've been making vaccines for nearly 50 years, specifically for COVID, as early as February and March, we offered two types of partnerships. One was starting engaging with the Gates Foundation as well as academia to develop a vaccine portfolio of our own, as well as enter into partnerships where we can offer our manufacturing services to other companies who are developing. I think that, given our reputation and our expertise, we were fortunate enough to attract companies such as Johnson & Johnson, where we're offering manufacturing services to them. And I think we're also quite pleased with the development of the portfolio that we have endeavored on our own. And we have our own vaccine going into clinic next week or so. Now, from capacity perspective, with the support of IFC, we've been investing in capacities from 2017 onwards. Vaccine manufacturing capacities are time consuming and capital intensive. So fortunately, we've had some facilities that we started investing 2 years back that we are leveraging now for COVID vaccine manufacturing. If everything goes well, I think by middle of next year, we hope to be able to make about 150 million doses per month, of our own and of our partners. So that's what we're doing from a manufacturing side. The second thing is, it's difficult to predict which vaccine will succeed. So we, as a company, we decided to, through partnerships and our own development, develop a portfolio of vaccines so that so we have 4 vaccines in various stages of development. So hopefully, if 1 or 2 succeed, we'll still be able to give the large volumes what is necessary, not only for India, but the rest of the world.
So a lot of foresight involved. Mr. Akuji, you're the CEO of a Pan-African logistics company, distribute drugs, vaccines, other medical supplies. Once there are enough vaccine companies like Mr. Mantena's are producing them, it's your job to get them to the people who need them. From where you stand, what is needed to ensure the distribution of a COVID-19 vaccine to every person in the country? And how important are effective health systems? And what do you do if they aren't available?
Thanks, Michelle. Yeah, look, I think it comes down to exactly like you say, access and affordability. I think on the affordability side, we're going to need support from organizations like the IFC and the World Bank and the various donor organizations to support Africa in terms of funding for these vaccines. And then access is something that we have to deal with on a daily basis. I don't believe the public healthcare sector has got enough capacity in many of the countries on the continent to deal with it. So public-private partnerships is going to be the way to go. We currently do a lot of that as Imperial with governments in South Africa and across sub-Saharan Africa, where we handle the distribution of vaccines and medical supplies into remote areas. One of the things we're also going to have to do is become innovative. I think the traditional channels in terms of getting vaccines and pharmaceutical products to Africa is not just about COVID. I think it's a broader issue. One of the things we have done is setting up modular clinics in rural areas where you set up a network of these modular clinics that can be used as points of healthcare. And we really want to invest in that and expand that on the continent, because once COVID is over, then we can use those primary healthcare facilities for further medical needs for the many countries. So that's some of the things that we will start doing is in terms of improving access by using these modular clinics, which work quite well in South Africa. We've got about 80 of these clinics that operate across South Africa. We want to expand that into the rest of the continent and use those as points of distribution for vaccines and any other medical supplies.
I mean, are there any specific challenges of getting those modular clinics up and running?
Not really. It's quite a simple process. It's basically a clinic in a box. So it virtually can fit in a container, and you can get it to any area and basically build it up or assemble it. And like I say, once that clinic is been built, it can be used for primary health care, for other type of medical supplies, not only for vaccines for COVID.
It's kind of like the home improvement DIY, but brought to the medical field.
Absolutely.
Mr. Montana, I want to go back to a point Mr. Akuji was just talking there about the need for private and public partnerships. He also talked about help from the IFC. If you can expand on that a bit more, how can we develop more local capacity for the future, including when other crises hit and other vaccines are needed? And then the second part to that question is, what do you do if the problem doesn't apply to developed countries? Does that sort of make it harder?
I think this is a very tricky thing in the sense that, so if you're preparing infrastructure for the pandemic, naturally it should not be used in such in a manner such that you can just repurpose it, and that's a challenge. So, for instance, we supply about 700 million doses to 1 billion doses of vaccine on a regular basis, and these are key vaccines for pediatric immunization around the world. So we do have the capacity to make 1 billion. Once a pandemic hits, we can't stop the routine vaccination such that we can repurpose it. So what does that mean? That means we have to have excess capacity sitting idle, waiting for a pandemic. And that requires significant investments and significant foresight from governments and world bodies to be able to invest in idle capacities and fund these idle capacities. The advanced countries are doing it, such as US and Europe have that, and they can afford that. And I'm afraid this is something that's not available in the developing countries, either by the governments or the private sector. From a private sector, it's not feasible to have capacities that are making losses either. So I think that's a bit of a challenge that nobody's been able to solve of having capacities that are ready for outbreaks. The second question is for diseases that are neglected, so to speak. I think that ecosystem has been quite good. There are a lot of NGOs, a lot of grants available for development of these vaccines, albeit maybe not as much as some people would want. But I think that ecosystem of targeting neglected diseases is better than preparing infrastructure for pandemics and outbreaks.
And Mr. Akaji, a final question for you. I wanted to know, what are some innovative approaches? You described one, but I mean, how do you bring healthcare and vaccines to populations hard to reach? I'm thinking of slums in remote areas. Are there any other innovative approaches that you're looking at?
Yeah, so we are a big distributor of pharmaceutical products across the continent. We get to over 50,000 points of sale across the continent. Just to give you a sense, we deliver about 43 million patient packs a month, through that distribution channel. And we can use that private sector channel as points of distribution. These are our pharmacies and informal traders as well. The challenge with vaccines will be the cold chain integrity of the product, because it needs to be temperature controlled. And there we have got control tower technology, and we have started using that in our business to be able to monitor and make sure that those vaccines, or whatever pharmaceutical products that need temperature control, gets monitored in giving you supply chain visibility and integrity. So using those many thousands of points of sale across the continent as points of getting the vaccines to people could be used, because we go to those points of sale. We're delivering pharmaceutical products 2-3 times a week into that network. So, one way is the modular clinics I described. The other way is to use the private sector in the informal space as points of distribution. It may require some investment, in terms of ensuring that those vaccines are temperature controlled in those points of sale. But you could effectively use those networks as well as a way to get vaccines quickly to the people.
Thank you so much. I'm glad you brought up the temperature control, because I think that is one issue people have been talking a lot about. I know one of the vaccines, there is talk it has to be stored very cold. Many thanks to both of you for some excellent insight into what's needed to ensure that everyone has fair and equal access to COVID-19 vaccines. Now, the bank's private sector arm, the IFC, is very much involved in supporting these efforts, and you can use the hashtag IFCHelp if you want to add your thoughts on this subject. Now, stay tuned for a special musical treat. Investing in women and girls is at the heart of the World Bank Group's work on human capital. And Bolio's Art is a hip-hop group from Guinea. This special song, Avec Elle, or With Her, is their anthem for the empowerment of women in Africa. Let's hear it.
Nous ne voulons plus être mariés mineurs, nous voulons nous-mêmes choisir nos maris et être propriétaires de nos terres. Nous voulons être respectés et être décideurs, ne plus être intimidés, violés. Nous voulons aller à l'école, c'est décidé, franchir les étapes et faire part de nos idées. Jamais plus jamais excisés ou être exploités. Nous voulons aller à l'école, c'est décidé, franchir les étapes et faire part de nos idées. Jamais plus jamais excisés ou être exploités. Gine haramane jinyera, ebere haramane jinyera, digine haramane jinyera, ayo jinyera, ebere haramane jinyera, digine haramane jinyera, ebere haramane jinyera. Si c'est vrai qu'elle est l'humanité, faut plus la soumettre en vérité. Dans les mains d'une femme préparée, le monde pourrait mieux se porter. Éducation pour nos filles, égalité pour nos femmes, halte aux violences conjugales, mutilation génitale. Sumni, Janneng, Finera ou bébé, si be jangi have body, bedang koto lay de day. Nene hai, nene hai, nene hai, nene hai, nene hai, nene hai.
Plus de 200 millions de femmes et de filles ayant subi une mutilation génitale, dont près de la moitié vivent en Afrique. Elles sont victimes de mariages forcés, de viols et d'exploitation. Une fille sur 10 est scolarisée. Tous avec elle, on dit non. Fondation Abdoumbaye.
I'm Michelle Fleury. It's been a pleasure spending the past hour with you. And now let me return to Paul Blake in the atrium of the World Bank Group's headquarters in Washington, D.C.
Thanks, Michelle. That was a fantastic program. We're back live from the World Bank Atrium in Washington, D.C. If you're just joining us, I'm Paul Blake, and the next few minutes are all about you. We'll have the results of our poll asking which of the following actions do you think will be the most important for ensuring a resilient, inclusive recovery from COVID-19. We'll have those results in a few minutes with Pabzi Mariano, but first we're answering your questions, and to do that, we have on set live with us Stephanie von Friedeberg. She's the Interim Managing Director of the IFC, as well as Executive Vice President and Chief Operating Officer. We also have Mamta Murthy, the Vice President for Human Development at the World Bank. Welcome to you both.
Thank you.
So, Stephanie, I want to start with you. We've got a question from Roy George on World Bank Live, and he wants to know how we can make sure that vaccines reach children all around the world. Vaccines are on everyone's mind right now because I think a lot of people view them as the sort of linchpin towards getting to recovery and kind of returning to normal or a new normal. What is the IFC doing to ensure that developing countries not just have access to vaccines, but to the medical equipment that's necessary to distribute those vaccines and to get them to individuals?
Paul, it's a great question. We know that the COVID crisis has really showed us the fragility in health systems in our countries of operation. And the private sector can and must play a role in helping make them more robust. So with that in mind, we created in July something called the Global Health Platform, which is a $4 billion platform that we've created to make funding available to PPE manufacturers, medical equipment manufacturers, and vaccine production manufacturers in our countries of operation. The first project that we did with a company called Biological E, which is a vaccine manufacturer in India, and they make childhood vaccines, which, if you know what's happening today, so many children are no longer being vaccinated because of the COVID crisis. So that's the first thing that we did. The second thing that we're doing, which is a little outside of our wheelhouse, is partnering with Gavi, CEPI, and others, because when a vaccine for COVID is actually created, we want to make sure that it can be equitably distributed with the help of the private sector.
So making sure it gets to everyone who needs it. And Mamta, I want to talk to you a little bit about two aspects that Professor Banerjee brought up here during the previous program. And he was talking about key areas where governments could focus to effectively protect and invest in people during this pandemic. And the first one was getting hands in the cash of people who need it. The second one was investing in quality distance education. Online on World Bank Live, we got a question from Dr. Soji Oyeranmi, and he was asking what the World Bank can do to encourage developing countries to invest in their people, not just in their physical infrastructure.
So thank you very much for those questions. Let me just add a little bit to what Stephanie said about the help that the World Bank Group is providing so that vaccines can reach everyone in the world. On the side of the World Bank, we have just approved a facility of $12 billion, which will allow developing countries to purchase vaccines, but more importantly, to distribute and deploy them. Because vaccines, especially the COVID-19 vaccines, they're not simple products. They're going to have to be distributed all over developing countries because they will be used to vaccinate adults as well as children. Many of them require quite complex logistics and cold chain facilities. Countries will also need trained healthcare workers, and they will need communications campaigns so that people aren't scared of the vaccine. So we're working on all these aspects with developing country governments so that the vaccines can be both purchased and deployed. And it's going to be a big global effort that we will partner in order to make it happen. Now let me come to the really important question about what is the World Bank doing on cash transfers and on remote learning. On cash transfers, we are scaling up. We're supporting governments to scale up cash transfers. So in the next 12 months, we hope to provide resources of around $10 billion so that cash transfers can be provided to the poor and the vulnerable, not just the chronic poor, but people who have become poor because of COVID, because they've lost their jobs, or because they've been furloughed from their jobs, or just because economic activity has come to a standstill. We're also working on remote learning. We are supporting governments in about 65 countries so that they can tailor their education programs for kids who are at home. And sometimes it's very low-tech stuff. It's reading materials that are provided, or it's radio programs, or it's programs on television. And sometimes it's more high-tech, learning through the internet and through sending materials via WhatsApp. So there's a lot of activity in this space that we're supporting.
Yeah, and I've read that it's close to 1 billion students are out of class or have been out of class as a result of the pandemic. Stephanie, we got a question on World Bank Live from Maria Corazon, and she's saying that education is extremely important in building human capital in this time of the pandemic. How can education flourish in places where there's no online connectivity? And she wants to know, what is the IFC doing to address this? And we've heard from a number of people on the importance of education, throughout the event, throughout today, in building that human capital and the terrible toll that the pandemic has taken. Can you talk to us a little bit about what the IFC is doing to support education when countries themselves are stretched financially?
So Paul, she's absolutely right. Education is critical to human development, but maybe even more important, it's an equalizer. And the COVID crisis has really showed us the inequalities in the world. So we need to focus on education. You said a few minutes ago, more than 1 billion children have been out of school. And when that COVID crisis hit, governments around the world scrambled. How are we going to make education available to our students if they can't physically go to a class? So they've done it with technology platforms. They've done it with broadcast, as Mamta rightly said. The problem is that 450 million of those children don't have access to the internet or to broadcast because their parents can't afford it.
Right.
And so the first thing that IFC needs to do is double down on digital infrastructure and closing that digital gap. And if we can do it, we can also help with things like cash transfers, because we can make them digital, we can make them transparent. That will be the first thing. The second area where I think we're going to focus is actually on tertiary education, because the COVID crisis has taught us one other thing. Digitization is coming, and it's coming even faster than we anticipated. So reskilling, upskilling is going to be really important for us to help create the worker of the future and to be able to function in the workforce of the future. So an example I would give you is that we invested in a company called Luminous, which is a really interesting company that functions in Jordan. And they have a spacemaker lab that was funded by the EU, and they bring Syrian refugees in and teach them how to use 3D printing. And
That's
again,
really cool.
new set of skills, using technology and helping them find jobs. So those are the kinds of things that we're going to have to lean into.
Helping people find opportunities, have the skills to be able to find opportunities once the recovery takes place.
Correct.
Mamta, I want to talk to you about the gender dynamics of the pandemic. In the video that was playing earlier, Melinda Gates referred to a shadow pandemic, and she was talking about how women and girls are disproportionately affected by the pandemic and by some of the economic shocks that come as a result of the pandemic. Can you talk to us a little bit about how the bank works to address some of these inequalities, both in the response maybe and in the recovery?
So unfortunately, the pandemic is affecting women and girls more. And we know this from previous tragedies and pandemics. So there's a lot that can be done. Let's start with personal protective equipment. We know that women form the majority of the health labor force. So if PPE is made available, it helps them do their job as healthcare workers. So one of the things that we've done as the World Bank is using a platform which covers over 100 countries. We're helping countries acquire PPE for their frontline health workers. The second thing I should say is that unfortunately during the pandemic, with things diverted towards treating the pandemic, there's been a decline in maternal and child welfare services. And this affects women considerably. So one of the things we're also doing is we're emphasizing the need for governments to continue to provide essential maternal and childcare services. And we do this ourselves, but we also do this in partnership with the private sector and with other agencies like GFF. The third thing I should say is that many women have lost their jobs and have lost their source of livelihoods, often because they work in the informal sector, and the informal sector has been very badly hit by the pandemic. So we're also assisting governments to provide cash transfers, as I said earlier. And this puts money into the hands of women's pockets, so to speak, and this helps them get through the pandemic.
And I imagine it benefits children as well.
Exactly. Fourthly, I would say that we're very concerned about women and girls being out of school. We've already talked about the fact that many schools are closed, over 1 billion kids are out of school, and we know that it's very hard for girls to go back to school once they've been out of school. So we're doing a lot on remote learning, as Stephanie already mentioned, but we're also working with governments so that schools can prepare to have girls come back, and they keep track of which girls haven't come back once schools reopen. And then finally, I should say that there's been a rise in gender-based violence because of the pandemic, and we're working with governments on putting in place strategies to help prevent gender-based violence, but also give a place for women to go to if they are victims of gender-based violence. So there's a lot that we're doing. I wouldn't say it's enough, but I think it's a very good start.
I spoke to Karen Groen back in the spring in the height of the pandemic, and she was emphasizing that the pandemic really hasn't been gender neutral. Stephanie, just as we close out here, COVID isn't the only challenge that healthcare systems around the world are facing. Can you talk to us a little bit about the IFC's response to healthcare demands and needs kind of more broadly, and the day-to-day needs to build and protect human capital around the world?
So in both our investment operations and our advisory services, we have a very robust healthcare and life sciences practice. In fact, our portfolio is about $2.4 billion, and it's invested across hospitals, medical equipment producers, technology, and pharmaceutical companies. Very recently, we invested in an interesting hospital in Ghana called New Crystal, and what we're helping them do is lift up the quality of service and expand their service. We invested with a company called International Medical Group in Uganda, and it's a medical services company that intends to reach hundreds of thousands of Ugandan citizens as they move throughout the country, and in many times in very low-income neighborhoods and in low-income communities. So those are some examples of the kinds of things that we've done. But in addition to that, into our investment and advisory operations, I also think thought leadership is important. And people are always asking, is the private sector the right place to be putting health? And so we created something called the Ethical Principles for Healthcare. And we're working with our existing partners and clients to make sure that they're making sound, ethical decisions in their investments as they move into bringing more private sector to the healthcare in their countries.
That's really cool. Well, Stephanie van Friedeberg and Mamta Murthy, thank you guys so much for taking time to be with us here today.
Thank you. It's very good. Thank you.
I'm Tony Joe Labus in Ottawa, Canada, and you're watching the World Bank Group IMF annual meeting.
Well, today we're continuing to shine a spotlight on the unique development challenges and triumphs of individual countries around the world. Today we look south to the Andes Mountains, specifically to the city of Quito, the capital of Ecuador, and that's from where resident representative Juan Carlos Alvarez recently spoke to me about the World Bank's work in that country.
I believe that it would be safe to say that the relationship or the partnership that we have with Ecuador, with the country, could be qualified as best practice at many different levels. I mean, we engage with the government, we engage with academia, we engage with other international financial institutions, with the UN system, with civil society, with the private sector. And I think that the relationship that we have with the government in the past 2 years have actually been strengthened. We went from not being able to have a policy dialogue with the government to actually being a strategic partner with the government in terms of policy dialogue. And that helps us a lot because it has helped us identify what priority areas we could work on with the government. One very important aspect is that for the very first time in 12 years, we were able to actually discuss with the government a country partnership framework. A country partnership framework actually lays out the program that the World Bank is going to be supporting for the next 5 years. By having this very close dialogue with the government, we were able to identify which are the priority areas based on their national development plan to ensure that they were fully aligned, that we'd actually provide the support the government needed in order to ensure sustainable and inclusive growth in the medium term. By having this country partnership framework, we also had the opportunity to engage with the civil society, with academia, because we were doing public consultations. I mean, the framework is something that the bank designs. However, it has to be informed by all the different key actors that are in the government, like the key actors that we have in the private sector, in the academia. And one thing that was very relevant is that for the first time, we were able to use social media tools. And actually, we were able to engage students, which are the future of this country. So we had a lot of interaction with them. And that helped us make sure that this country partnership framework actually took into consideration the opinions and the ideas of multiple actors in the country, particularly the young and the students.
I want to talk to you about COVID in particular. I mean, I know every country around the world has been impacted by COVID, but Ecuador certainly had a particularly rough go of it back in the sort of early months of this year and towards the middle of this year. Can you talk a little bit about how the bank, the government, partners are responding, and in particular, as we're talking about human capital today, what it's meant for sort of human capital gains and potentially even reverses on the sort of human capital front?
Absolutely. I think that before we talk about the impact that COVID has had in the country, we have to actually understand the context, the country to context before COVID actually hit. So Ecuador was already going through a very difficult fiscal situation, and that demanded or requested the government to actually embark on a tough fiscal consolidation process. Of course, at the same time, while they were going through the fiscal consolidation process, they made sure that they had enough social safety net to mitigate the impact of this consolidation process on the vulnerable. Now, when they were going through this difficult fiscal situation, then the oil prices actually dropped a lot, and then we had the pandemic hit. So you can imagine that already a very difficult situation was exacerbated by these two external situations. So,
and oil is important to Ecuador. I mean, they're a big oil exporter, are they not?
Absolutely, exactly. They rely on that. So if their situation was already bad, and then COVID hits, and then the steep oil prices decline, then it was very difficult for the government to face this COVID situation, and the impact has been very severe. Actually, the government had made significant gains in the last 10 years. They were able to lift people in poverty, and actually with COVID right now, all these gains have been lost. And talking in numbers, that the IMF has mentioned, and the World Bank has also studies saying that at least 1.8 million people will fall back into poverty. And those are 450,000 families that will have to, face a difficult situation again. So in terms of, all the capital gains that the government had made in the past 10, 15 years, we are struggling also to try to help them to ensure that, there's some sort of stability for these people. So in terms of like education, all these kids who were going to school now, they're trying to do, remote distant learning, and it's very difficult in the country with limited internet access. About 500,000 people have lost their jobs. So it is a very, very difficult situation. I think that the government is taking the right steps in the right direction also to try to see how can better, support these people in terms of social protection programs, in terms of, finding alternatives for employment generation, in terms of granting financial access to micro, small, and medium enterprises. But it is a very tough situation.
And you talk about all the challenges there. You have this robust, important portfolio in Ecuador. Talk to me a little bit about how it's being directed, and your work is being directed at the most vulnerable people. So I'm thinking indigenous people, people of African descent, people in rural areas in Ecuador. Talk to me a little bit about the work that you guys are doing with those groups.
Yes, the Ecuador portfolio, the bank's portfolio in Ecuador is actually pretty big. We have actually doubled the size of our funding from 2 years ago, from 1 billion to 2.2 billion. But most of these programs actually aim at the protection of the most vulnerable. So as you mentioned, for instance, one of the projects that we have is a social protection program that actually aims at ensuring that, the people who need the most are actually the ones who are benefiting from these social protection programs, which are basically cash transfers, for people in need. We are revising the social register to ensure also that this is better targeted, that actually the people who need it the most are the ones who are receiving it. And as I mentioned before, because there are more people falling into poverty, then we have to make sure that we are expanding or implementing these social protection programs. The most vulnerable people, of course, are those who are in the rural areas. We're also recently designed an operation, which is an indigenous people operation. And this operation, the beauty of this operation, that actually the design of it was not only designed between the World Bank and the government, but actually it was designed with leaders from the indigenous communities, leaders from the Afro communities, and leaders from other minority groups here in the country. And in that way, we ensure that the support that we're providing is very inclusive. Now, we are about to sign this legal agreement, and we're just getting ready to implement it. But again, this is going to be benefiting, these minorities. We also have education programs. We have water and sanitation programs. And one very important project that we have actually is a rural irrigation program that is actually aimed at helping these, small little producers in the rural areas to make sure that they have the means to be able to survive during this crisis.
What kind of gives you hope? What's kept you optimistic over the past few months?
I think what gives me hope is to see this sense of unity and sense of identity of the Ecuadorians. I think that, when they face this difficult crisis, actually, they came together to try to support each other. Another thing that gives me hope is seeing the government that actually has vision and has, the interest of the people, as a priority. One of the things that has happened, I mentioned before that the country was going through a very difficult fiscal situation. But one of the things that's happened, even though they were going through this very tough time, was that actually the government increased and expanded the implementation of these social protection programs and the granting of cash transfers for these people who are being most affected. In my particular case, I've been here for the last 2 years, and I think that something that is very rewarding is actually to see how committed the government is to supporting and ensuring that there's, clear sustainable growth and the development, social and economic development of people. I've been in the bank for about 20 years, and most of those 20 years, 15 years, I've actually been working in the field. And I think that also gives me a lot of motivation and incentive, because by working so closely with our counterparts, by being there, we make sure that actually we have a positive impact, because we have a very close and tight dialogue. And then we can actually be able to help and bring all this value added that the bank, as an institution, as a global, the World Bank, IFC, MIGA, World Bank together, actually can provide some support and financial and technical assistance to ensure at least that the government has some of the tools that they need in order to survive or to support the people that need it the most.
Juan Carlos, thank you so much for taking the time today. It was really nice to hear from you.
Thank you.
Well, it's that time of day that we check in on the online conversation. There's no better person to do that with than Pabsi Mariano. Pabsi, started me out. Poll results, what have they shown?
All right, so we did ask people which is the most important for an inclusive and resilient recovery. The choices were delivering vaccines to the most vulnerable, safely reopening schools, providing cash to struggling families, and ensuring girls and women have equal access to jobs.
And the winner?
You have this guess, so you're correct. Delivering vaccines to the most vulnerable. You predicted it, Paul. Out of 5,784 votes across all our platforms and in 4 languages, it got 51%.
Oh, wow, 51% for vaccines. Yeah. And the others?
And the others is like 20, 21, and there's one with 8%.
So far and away, the vaccines forefront of everyone's mind. So we talked a lot about polls, we talked a lot about questions. The project that I find kind of most fun, at least, is the digital mosaic. And I think we've got an image of it now. Tell me a little bit about what it is. And we've got, I think, just a little bit of time left to be able to contribute to it. How can people contribute their photo to it?
So because the theme of the meetings is supporting a resilient recovery, we wanted to ask people what resilience means to them. And they can show us through pictures. So this digital artwork is entirely made by people's photos from around the world.
Okay, and people can upload them on live.worldbank.org. You've been reviewing them, you and your team have been reviewing them. Tell me about some that have maybe stood out to you.
So a lot of these have been about young people speaking up about social injustice, and that's what defines it as resilience. Some of them have also shared about stories of successes during this difficult time. So to not give up on your dreams, even though, there's some adversity.
A lot of headwind.
Yeah. Exactly. And then lastly, a lot of them also shared about family. So being, healthy for your family is also a form of resilience. So very inspiring stories all throughout.
People need to make sure they get their questions or their photos in here in the next day or two. I think you're revealing the full mosaic on Saturday afternoon?
Yeah, so on End Poverty Day, the image will be revealed. It is, you'll get an idea what it is already.
You can kind of see what it looks like already.
But there's still space, so please add your photos.
Definitely. It's about, 70% done?
I would say 80.
Okay.
So we're there. We're almost there.
Okay. Briefly, talk to me a little bit about what's coming up. Today's day 3. What do we have left here in the remaining 2 days of the annual meeting?
There's still some exciting events ahead. So tomorrow, we shift back 2 hours, and starting at 10 a.m. on the east coast of the US or 1400 GMT, we're talking digital development and closing the digital divide. And on Saturday, it's End Poverty Day. We'll be looking at the latest data on how COVID-19 is threatening the economic security of millions. And of course, you can watch all of this back on World Bank Live.
And be sure to set your alarm for 2 hours earlier tomorrow, because we'll need you here to walk us through it all. Papsi, thank you so much. Well, that's a wrap on the third day of the 2020 World Bank Group IMF annual meetings. Do join me and the rest of the team tomorrow at 10 a.m. Eastern. That's 1400 GMT, 2 hours earlier, as we look at how to close the digital divide. It's going to be a great program, but until then, stay safe and have a good afternoon here from Washington.
From Mexico City.
In Athens, Greece.
In Lome, Togo.
From Mexico City.
In Athens, Greece.
In Lome, Togo.
From Mexico City.
In Athens, Greece.
In Lome, Togo.
From Mexico City.
In Athens, Greece.